The United Workers' Party has been promoting a proposed $75,000 health insurance levy as a helping hand for citizens. But Prime Minister Honorable Philip J. Pierre is warning people not to be dazzled by the figure, with national healthcare costs sitting at around $219 million. He argues that the UWP still hasn't explained how such a plan would realistically be paid for. Pierre says the public deserves clear answers. He wants the UWP to spell out the basics. What would the premiums look like? Who would be responsible for paying them? Would pre-existing conditions be covered? What limits would apply? And how would the insurance company even be selected?
It's okay to say $75,000 life insurance. There are absolutely no details. We don't know what's the premium. We don't know who is paying the premium. We don't know what's going to be covered. We don't know what's going to happen to pre-existing conditions. We know nothing. We just have a blanket, what they call in patois, a job attack of $75,000. Absolutely no details.
In contrast, the SLP's Universal Healthcare Program is already laid out with full details and has started rolling out on the ground.
We've begun with free PSA testing. We began with free pap smears. We have begun with free treatment for diabetics and hypertension. And only last week, we moved to free mammograms. And we've said there's going to be a basket of goods. But whilst we are doing that, we are getting the information systems going so that there can't be duplication.
As for the UWP proposal, Pierre dismisses it as a recycled election pitch from a promise that, according to him, hasn't progressed at all since it was first floated. He argues that despite all the talk, there has been no real action from the UWP towards bringing that $75,000 plan to life. Chloe Dantes, NBC Prime.